Hi, everybody. Welcome to week 7. We are talking about curriculum design and evaluation of program outcomes. These are some of my favorite topics. Um, I tend to take the approach that Hilda Taba, T-A-B-A, uses in curriculum design. It fits more with my left brain side of me. It's a very stepwise approach. I, in recent years, have really become a fan of concept-based curriculum. So instead of having like MedSurg 1, and we're going to talk about respiratory and cardiac, or we're going to talk about specific systems, um, like in a fundamentals course that I had taught, we did oxygenation, perfusion, um, and different things like that, digestion, and really focused on concepts across the age spectrum, more so than just specific diseases. So that if you know how to take care of a neuro patient or a respiratory patient, you can use those principles to apply to any respiratory illness, cardiac illness. Anyway, it's a real fun way to teach. I really quite enjoyed it. And also, I believe in curriculum that is certainly student centered, for them to be able to achieve the outcomes that we need them to have at the end of the program to be successful nurses and to pass their NCLEX. So I really love talking about curriculum design and evaluation of program outcomes. If during your practicum you're working in academia and you have a chance to look at how various schools are evaluating their program outcomes, that would be a great experience. When I was a dean, that was something that I worked on quite a bit and really involved my faculty in looking at very actively at what were our program outcomes, were they appropriate, and then measuring them continually to see how we were meeting them, and using that data to drive changes in the curriculum. And so curriculum shouldn't be a static thing that is the same forever and ever and ever. It really should be active and living and responsive to the outcomes, to changing healthcare requirements, changing community needs, things like that. So I find curriculum design and evaluation of program outcomes to be a really exciting area. All right, so I look forward to reading what you guys have to think about that. It may not be something that you really get a chance to do during your practicum, but hopefully it's something you'll think about. And even if you are going to be teaching in the clinical setting, you still need to look at curriculum design. For instance, new graduate programs, residency programs, um, new hire programs, yearly competency programs, how you're going to design taking care of a new group of patients, the education for that. So it fits no matter what setting you're thinking about it. Even if you're developing simply patient education materials, there is a process to it. And so I think this topic really applies to everyone. Okay, few things. Midterm evals are due February 10th. If you were one of those students who started your practicum later, you can contact me in your individual forum if you want to push that back a week so that you have a little bit more time with your preceptor before that's due. But you do have to let me know in your individual forum and request that. And also, certainly, if you have any questions about the midterm eval, remember you will be uploading a copy to your assignment area, and your teacher will be emailing me a copy, tracy.hardell@gcu.edu. All right, and the last thing I want to talk about is we're getting a little further in the course. Some of you are thinking about various positions that you're going to apply for. If you are applying to academia as a classroom instructor, on ground particularly. You will very likely be asked to do a teaching demonstration. So you'll need to develop a topic or you'll be assigned a topic. I've had it both ways. And you'll actually do a presentation at least in front of other instructors, and they also might have some students come in. So I just want you to be prepared for that. If you're looking at being an adjunct clinical instructor, it's not very often that you'll have to do a teaching demo, although you will be doing teaching in post-conference. And if you're going to teach online, you usually don't have to do a live teaching demo, but they may ask you about your teaching experiences and things like that. If you're going to be looking at being a clinical or an instructor in the clinical environment, like a hospital nurse educator of some sort, it is possible you might get asked to do a demo. That process tends to vary a little bit more by hospital or healthcare corporation. So just some things to keep in mind. And later in the course, I'll probably post some things about interviewing for positions and some stuff like that, just to give you a little bit of heads up. All right, so that is this week. I look forward to hearing about curriculum design and evaluation of program outcomes, and I'll see you in the main forum.